Good afternoon, everyone, and welcome to today's webinar. I'm Anne Livingston, and I'm the chair of the Expert Reference Group for the Queensland Government-funded Community Care Smart Assistive Technology Collaborative. Today I'll be the moderator for today's webinar titled Changing Perspectives, Why Consumers Are the Key to Smart AT. Many of you know that this webinar is part of a series of sessions being facilitated by Community Resourcing for the Community Care Smart Assistive Technology, and that these webinars have been designed from feedback and requests that we have received through the collaborative. Our webinars are bringing together local, national and international perspectives in research and development, as well as focusing on the deployment of smart assistive technology in the community care sector. We're lucky to have extensive international linkages, and our colleague today, Dr Malcolm Fisk, is one of those many projects and research activities that we have linkages to. And you'll see a few of those names of others on the slides as we go through. For those of you who have attended previous sessions, we know that we have been, Community Resourcing has been funded by the Queensland Government to bring together an online platform for community care service providers who are interested in collaborating on issues and practices related to smart assistive technology. Our project has achieved extensive national and international geographic reach, and this is growing daily with around 1,400 individuals collaborating on the platform. We've also introduced a consumer access site, and we're very proud to say that we've employed co-design and collaboration concepts with consumers in developing this new area, and we look forward to any feedback that you might have for us on this enhancement. Please note, as in all our webinars, that neither Community Resourcing or the Department of Communities, Child Safety and Disability Services of the Queensland Government are promoting or endorsing any particular product, research entity or organisation. Rather, our webinars serve to inform viewers of examples of smart assistive technologies in their various forms in development or in deployment in the sector. Some practicalities as attendees at today's session, and in the interest of recording, we've muted your microphones. But we encourage you to think and ask about the questions you might like to ask today's presenters. And these questions can be added to the question pane on the dashboard to the right of your screen. There will be an opportunity at the end of the session to have these answered, but at previous sessions we've been inundated with questions, so please post your questions early to ensure that we can cover it in today's session. In today's session, it's my great pleasure to welcome Dr Malcolm Fisk. Malcolm's and Community Resourcing have been undertaking a number of projects over a number of years, and in today's presentation he's going to explore some of the disjointed dynamics around assistive technology and health and care. By way of introduction, Dr Malcolm Fisk is Senior Research Fellow at De Montfort University within the Centre of Computing and Social Responsibility. He is also Director of the Telehealth Quality Group in the European Economic Interest Group. In his university capacity, he leads the European Commission-funded Progressive project that is addressing standards around ICT for active and healthy ageing. This project focuses on the key issues that relate to smart homes, telehealth, co-creation, and importantly, interoperability. As Director of Telehealth Quality Group, Malcolm is actively engaged in supporting the development of telehealth services according to appropriate service paradigms. At the heart of this work are quality benchmarks for telehealth, seen as relating to a wide range of domains and very much from a user perspective. Hence the development and promotion of his passion, which is the International Code of Practice for Telehealth Services. And several services in the UK and internationally are now seeking certification against the requirements of the code. Malcolm wears a variety of other hats and undertakes a variety of other roles, including being expert advisor to the European Consumer Voice on standardisation. In this capacity, he participates in 2 European committees, one being the Quality of Care for Older People and another being the Health Services Focus Group. He's also a member of the Quality Standards Advisory Committee for NICE, which is the UK National Institute for Health and Care Excellence, and the European Commission in respect to their program concerned with robotics. He's also involved in the European Coordination Hub for Open Robotics Development, and previously he was appointed by the Welsh Government to chair the National Partnership Forum for Older People, and subsequently provide expert advice on issues relating to addressing poverty and inequality and housing and related support needs for older people. It's my great pleasure to welcome Dr. Malcolm Fisk to today's presentation. Welcome, Malcolm.
Hello, Anne, and hello, colleagues from the reference group. I'm very pleased to be with you. I'm just in the process of sharing my screen so that I can talk to you about why consumers are the key to smart AT. Thank you, Anne, by the way, for that introduction. I'm quite exhausted by all the things that I'm doing now that you've reminded me. But nevertheless, hopefully it means that I've got a few perspectives which I can bring to bear, which are relevant to the participants in the webinar this morning. I suppose the first thing to ask about, or just to clarify, is what we mean by smart AT. Now, clearly, within your organisation, and you have got a particular remit around smart AT. For me, and for the purposes of this presentation, I'm talking about electronic devices in the home, but also which people can use when they are on the move. So they embrace social alarms, which we can probably agree are not very smart, though they might have been when we first had them 30 or 40 years ago. We're talking about telecare and telehealth. I actually would embrace telecare within the broader frame of telehealth, but we could argue about that another time. And these kind of devices clearly are more and more intelligent. They're getting smarter, and of course they interact through communications networks which have increasing capacity. And so that smartness, that intelligence, and therefore the range of services that can be offered using them is increasing. mHealth, mobile devices with apps, particularly very, very smart indeed, and again, more and more access to different services and so forth through those devices, and increasingly coming onto our agenda, and some people see a great future around wearable devices, fitness trackers and so forth. And just to make one comment about those at this very early stage around their wearables, is that this very much takes concerns that we may have had around health and particularly long-term conditions for older people. It brings them very much into the arena of all people and of all ages, especially bearing in mind that there are some people who are fitness fanatics who are starting to use devices that we can see as having application or usability in the context of older people and other people who may have particular health or support needs. And all these, or some of these electronic devices in the home, or that are portable devices, clearly provide us increasingly with access to health and support services. Perhaps that's our primary concern, but it's so important for us to recognize that they also increasingly give access to information, which can be information about anything, about the train times from the local station, or indeed a particular health condition which you may have a concern about. or indeed giving access to all kinds of things available through online communications networks, family, social, education, work opportunities, and so on and so forth. So I guess the initial message is, yes, we're talking about smart AT that is around health and care, but goodness me, that same smart AT has also got tremendous wider implications for people's engagement, involvement in different kinds of activities, and for people of all ages. Crucially important to remember that, because when we touch a bit later on the issue of inclusion, this of course means that older people who may have a support need can have access to the kind of opportunities that perhaps the previous technologies did not enable them to have. Now, on the edge of our thinking, and something that I won't be talking about particularly unless they come up in discussion, but on the edge of our thinking are robots and robotic pets. Some of you will be aware of the role of robotic pets, for instance, with things like Paro, the robotic seal, and things like this, particularly giving comfort to people with dementia. Those kind of devices certainly have a role to play, but I don't think we're going to touch on them very much today. I personally, by the way, am quite angry sometimes about the predisposition of some people to get very enthusiastic about anthropomorphic robots, when actually what we need is automated devices that help us to do things without putting a smiley face on them and thinking they might have a role in companionship as opposed to helping us do things. And also on the edge of our thinking are surveillance technologies. Something we need to bear in mind. I mean, I've been doing work around surveillance technology in care homes in the context of the prevention of elder abuse, but don't forget that many of the technologies that we're talking about now, because they are gathering data in different kinds of ways, have actually got a surveillance function, especially when they do take personal information or they do actually capture images of what may or may not be happening in our homes or in the streets and so forth. So that's what we're talking about with regard to smart AT for today. Consumers, yes. Why consumers are the key to smart AT? Well, we better be clear what we mean by a consumer. And a definition that we have here, which has been adapted from ANEC, which Anne mentioned in the introduction as the European Consumer Voice in Standardization. A consumer is a person purchasing or using property, products or services. And just before just talking a bit more about comparative terms, let me just mention ANEC, the European Consumer Voice on Standardization. It is an independent body funded by the European Union effectively, and I actually have quite a good relationship with them, and I actually do some work for them in relation to 3 committees. Anne mentioned 2, actually I'm now on a 3rd one as well. And what they try to do is to make sure that all products and services are safe, interoperable and accessible to all, with the environmental impact minimized. And the mention there of products and services is important, because very often we think of standards in the context of particular devices, but services are very much coming more and more into the mix when standards are concerned. But also the mention there of safety, interoperability and accessibility brings into our minds, I guess, 3 important issues that it may be ethically justifiable for us to pursue if the technologies and services that we have or that we offer are going to be appropriate to older people or other people with support needs. Now, the 3 groups that I'm involved in on behalf of ANEC are, Anne mentioned a couple of these, but certainly the Health Services Focus Group, which is trying to develop a strategy for the European Union around health services. Health is not a particular function of the European Union, by the way. That's something that devolved governments tend to have responsibility for, but nevertheless there are strategic aspects of health services that the European Commission wants to influence. The one at the bottom there, quality of care for older people, is a new technical committee of SEN, which I'm involved in, just beginning its work, and where we're, I think, going to be quite revolutionary, if that's the right word, certainly radical, in turning on their head some of the old top-down, we know what's good for you kind of approaches that have been perhaps the hallmark of some care services for old people in the past. And I've just been brought into another technical committee, which is Service Chain for Social Care Alarms. I was a bit reluctant actually to get involved in this one because social care alarms, social alarms are somewhat unsophisticated, and I regard as having an important role to play, but actually because they lack intelligence, they're not providing the kind of functionality that I would like to see in our future systems. But I've agreed to go onto this particular committee because hopefully I and others on that committee will be able to influence the way in which social care alarms or social alarms evolve in order to provide intelligent hubs within the home where the functionality may well be replicated on mobile devices that people take out when they go to work or when they go on the bus or go to the shops and so forth. So that's ANEC. They're actually quite an important, albeit small organisation in the European context that tries to champion the consumer voice. And they sit alongside, by the way, two other organisations, one which is concerned with workforce issues and people's rights, and the other one which is concerned with protecting the environment. Right, back to consumers. Yes, the person purchasing or using property, products or services. The fact that they're purchasing or could be purchasing services suggests quite a high degree of control. And if we compare that term, the term consumer, with some other terms which we might use or we do see used in the context of care, we have customer, and then that's a person or organisation that receives a service, a patient, a person in receipt of medical care, a client, a customer or someone who receives services, or service user, a person who accesses and or uses services. And the first three of these, customer, patient and client, are all concerned with someone who receives something. And there's a question mark there as to the extent to which people are involved in making decisions about what they receive. And certainly there isn't even a nod very often to the kind of co-design, co-creation, co-partnership kind of approaches that Anne hinted at in her introduction. In the UK, we tend to use the word service user, which I think is better. It's certainly not perfect, but in referring to someone who accesses and or uses services suggests there's more of a two-way process, and in that two-way process there can be different degrees of empowerment, partnership approaches and so forth. So consumers, not a bad term, bearing in mind the implications that it has for people's control and influence over the goods and services that they may receive or they may look to consume. Right, the consumer, of course, is positioned in all sectors, so he or she is very relevant whether they're seeking services from private, public or third sector bodies. And the consumer's position in accessing different kind of services and so forth is clearly impacted on by a number of imperatives. And these are political, economic and social. I'll mention these fairly briefly so that we can get on to the meat of the presentation. But of course we know all about demographic change, but I really do get a little bit angry about people who point to cataclysmic notions about our aging society because of the huge numbers of older people who will become dependent, especially on the beneficence of the state and public funds and things like this, when actually, of course, there is an increasing number of older people who may be frail and need support, but there's also an increasing number of older people who are very active and very able. And quite clearly, if we can ensure that they are self-supporting to a large extent, engaged in community life, engaged in work perhaps to a later age, and looking and involved, if you like, in increasing their literacy, all these kind of things, this can help make sure that where people do have substantial support needs, they can be met reasonably well. There is the question or the imperative around public sector service affordability, and there's questions there as to who are going to be the deliverers of services in the future. And clearly, because of, I guess, the people who are at this webinar thinking that there has to be a welfare element here, then I very much hope, or we would very much hope, that public sector funding is still in the mix there. There is an imperative around older people's rights and status. I'm not sure the situation in Australia, but certainly in many European countries there are strategies which aim to assert very much more strongly than has been the case in the past older people's rights. and they are pointing to things around the accessibility of buildings and services, the older people in work, transport, and all the rest of it in a very, very positive kind of way. And even questioning, by the way, the whole notion of retirement, which itself, well, the word retire has got all kinds of negative connotations. And linked with that is this agenda for inclusion and fair access to services for all people within different communities in all their diversity, and the need or the imperative to adopt what I'm calling ethical touchstones, which relate to consumers, relate to older people, certainly in our society and in the context of care and support. Right, where are we? Ethical touchstones, here we go. I'm starting to collect these. I don't want to have too many of them, if I'm honest about it, because otherwise it just becomes a rather complex and perhaps a tick box list, which it should not be. But there are imperatives, and there will, of course, remain imperatives around care, protection, and support, and they will include traditional forms of care for the most needy in our societies, and we could argue very much that they are the badge of a caring society if we have the frameworks in place that do provide that kind of care. What I think the main danger is that care can become something of a commodity, or it's too task-oriented, and kind of the human bonding and love and affection and all those kind of things that are very often in the mix can get devalued in that kind of context. But never mind, that they still need to be there, care, protection and support in different kinds of ways, but in a very, very personal kind of way, which reflects, if you like, our common humanity. So some positives there, but nevertheless an important ethical touchstone which needs to stay in place. Other ones which I touched on very lightly already: inclusion and non-discrimination on the basis of a whole range of different facets that we have, or a whole range of different needs that we have, and linked to that, the accessibility, affordability and usability of technologies and services. There's no point in us going for high-tech solutions, smart solutions, if you like, if they're only available to a rich elite. So a very important point to maintain there. And there is, of course, a danger, and I'll say it now in case I forget to say it later, that we could have a two-tier society if we don't pursue that ethical touchstone, or do justice to that ethical touchstone of accessibility and affordability. Status of older people as equals, no retirement, a question mark there. But nevertheless, part of the deal is that there are obligations for all of us of all ages to adopt more appropriate lifestyles, behaviors and so forth that enable us to, first of all, be more knowledgeable about our health and our and so forth, but also to play a bigger role in the management of our health conditions. And linked with that quite clearly is the ability for us to both support ourselves and to be helped in being supported at home or in work, wherever it is that we happen to be active. There is a link here which we will come on to around the industry perspective. We want industry and commercial organizations to be responsible in the way that they address what they would see as a market for care and older people. We don't wish to see exploitation taking place. There was something in the press just a few days ago in the UK which was pointing to care firms that operate nursing and care homes in the UK advertising or seeking investors on the basis of a 11% return on their investment, and they were arguing that this is excessive and actually it's compromising the quality of care that's provided in those care settings. And they were arguing for something like a 4 or 5% profit margin to be appropriate to attract the investment that was necessary, rather than be seen to be, if you like, rather shamelessly perhaps exploiting the care business for profit. There are some issues around responsibility in industry and commerce that relate to technology and service designs, interoperability as well, which I think I shall come on to a bit later. And linked with that, and linked to the tremendous growth in technologies, the issues around privacy and confidentiality, and the need for them to be built into products and services and the way that those products and services are designed. So why consumers are the key to smart AT? There's a number of reasons. Clearly, we've got changing healthcare systems. Now, in Australia, you're far more familiar than I am about this, but you have consumer-directed care. By the way, I'm not too keen on the term directed. It just seems a little bit dictatorial there, but never mind. I get the idea. Moving towards a future aged care system that is more consumer-driven, market-based, and less regulated. Okay, there's some positives there, and I think I've already said that the word consumer at least implies a certain amount of power and ability to make decisions and so forth, and there's no doubt that consumers will be influenced the nature of that market. Regulation, well, we may need regulations, but perhaps not rigid regulations. That's a presentation all of its own, actually, around standards and things like that. In the EU, things do vary between member states, but there is a general predisposition on the part of the European Union to promote growth and competitiveness. So they're talking about, again, a business orientation around healthcare systems. But they are firmly, what's the right word here, influenced, laced even, with a smattering of requirements that relate to some ethical and moral and important issues like social inclusion, service integration, the integration of health and social care, affordability, and choice for users, choice for consumers, including people being able to access services across borders. Now, that clearly is a more meaningful suggestion in the context of Europe, with its, or the European Union, with 28 nations, as opposed to a large country like Australia. But even so, there's probably a market developing, I guess, in Southeast Asia and Australasia that relates to some kinds of healthcare. Now, why consumers are the key? Well, there are massive barriers to change within existing healthcare systems. So in many senses, consumers are going outside of those old systems to find the services or to use technologies that actually enable them to access services in new kinds of ways. And many of these services are, of course, reasonably affordable, and not to put too fine a point of it, many older people are well resourced and able to access different services that are outside the publicly funded health systems. There are, of course, rapid technological developments. So even if some would suggest that older people are less ready to take up some of those technologies, actually that's being proved something of a myth, bearing in mind the extent to which now the use of mobile phones and iPads and things like this has reached many older people who may have been previously thought as less likely to take up those opportunities or those technologies. Linked with that, of course, are changes in consumer expectations for old and young. I illustrate two consumers on this slide. Funnily enough, these are both actually taken from Australian sources, but consumer number one, active older person, engaged, involved, probably reasonably technically literate and so forth, and certainly able to make decisions for herself. And consumer number two, a young chap who, of course, as he grows up to adulthood, would be very technology aware and able to access services and so forth in very easily and readily, or he would have the knowledge to do that, to help manage what clearly his conditions, like diabetes or whatever it is that he has, which he will have to manage in his adult years. So different kinds of consumers, certainly positioned to influence healthcare systems, and certainly in a position to access private sector services to bypass, if you like, some of the public provision if they find that as inadequate. The consumer context, the technologies that will make the difference are not the ones perhaps which we have been giving quite a lot of attention in the 5 years around vital signs monitoring, which is a kind of rather narrow view of telehealth that we have so far, but which nevertheless are really extensions of the clinical services where doctors and others are wanting to gather data to help them manage somebody else's health and well-being, but where perhaps the participation and involvement and control of the patient, of the consumer, has not been adequate. It's not social alarms or telecare, though those kind of technologies will have a residual role, possibly a growing role, but not very rapidly growing, in order to support people in certain circumstances. But the technologies that will make a difference are associated with services that reflect a different healthcare approach, not the traditional healthcare approach, and operate in accordance with the ethical touchstones that I have mentioned. Certainly they will be more consumer oriented. So they, as I mentioned when we were talking about all ages and thinking about those two consumers, concerned as much with lifestyles and behaviors as they are with treatment or management of long-term conditions. And there are some issues around personal health data as well, and the way that people are engaged or involved in the services, so that they can actually entrust their data to those services in order to help them in the management of their different conditions, but with personal data being owned by the customer, and so with the by the consumer, but with the consumer very much as an active contributor to his or her own health. Now, tomorrow's healthcare technologies clearly must take account of this consumer context, but manufacturers and providers are making sense of a fragmented market in a painfully slow way, it seems. I'm sure there are many exceptions, or increasing numbers of exceptions to this, but I don't think we've yet reached the tipping point whereby there'll be a cascade of new services that will change things dramatically for the better. But interestingly, I mean, the point is that if you're a manufacturer or designer of products and services, it may be that you would ask yourself the question, well, who are the experts around older people and their health conditions, and maybe the initial reference point they would have would be the clinicians. But I'm arguing that the best reference point quite clearly is the customer or the consumer, albeit that those consumers will have changing expectations that are eager to be realized through the new technologies. And that approach, of course, or seeing the customer as the best reference points, reflects one of the ethical imperatives that I've mentioned already. So limited growth in social alarms, I think, is predictable, but clearly they still retain an important role around falls, around security, around giving reassurance to family members and so forth. And the simplicity of those devices actually may be an attractive point for many people, as opposed to what may be perceived as the complexity of some more sophisticated, intelligent, smart technologies that are becoming available. Having said that, the sophisticated technologies can also be simple to operate, and if they have the right kind of interfaces, then people will increasingly use them and adopt them, despite the fact that they may have some fantastic stuff that's going on internally. Possibly a shrinkage or limited growth for traditional telecare markets, we shall see. But because we have a rapid growth in video communications, because we have some growth in wearables, because we've got mobile phones and so forth, then I think that is where the big growth is going to take place. And with improved designs, better interfaces, then those will be the kind of technologies where the take-up will be rapid. Some growth in the use of apps, of course, but there's so many apps which don't really provide much benefit that maybe we shouldn't give them too much attention, excepting to ensure that that there's some kind of controls regarding the different apps and their credibility, their usability for different consumers. So maybe the growth, as I say, wearables and video communications and so forth, based on the new technologies, that's where tomorrow's health technologies will be mainly focused. Will consumers be the key? Yes, but the question is why. I think consumers will be the key because of the slowness of traditional and often public sector service providers to adapt or to amend to the new developments that are taking place, and they're slow to respond to consumer aspirations and the use of new technologies. There is, by contrast, a rapid growth in consumer-oriented technologies and services in the private sector, and the accessibility of those technologies. Accessibility both in terms of usability and cost. And one reason why, of course, such new frameworks will develop rapidly is because those costs are coming down and down and down, and the functionality is increasing, which is quite an exciting prospect, really, if we can get it right. There's some rigidity in the processes adopted by traditional service providers, and of course there are cultures that need to change, and there is, to put it bluntly, some defensiveness and protectionism amongst some professional bodies, and certainly trade unions as well, who you would hope would be supportive of changes to new ways of working. So I think coming towards the conclusion is that there is a new tranche of providers emerging, often in the private sector, and I would like to see that in the public sector as well. But in order to meet consumer demand, there's a number of dangers that they, regardless of sector, must avoid. There's the danger of not acknowledging the ethical touchstones, such as accessibility, such as interoperability, such as involving and engaging users in a co-design process where appropriate. There's the danger, which I'm going on about possibly a bit too much, to protect, there's the danger of cyber threats. Because whilst a lot of people point to the importance of trust, perhaps what they don't, I think, consider sufficiently is the possibility of a precipitous loss of consumer trust and confidence if there are major threats of people's personal data and so forth amongst this emerging tranche of new service providers. And there's the danger of not adequately recognizing the political, social, and economic and demographic imperatives, and still treating older people as if they are some kind of passive patients who will do really what the clinicians and others say as far as their health is concerned. Conclusion: yes. Are we moving towards consumer orientation? Most certainly, yes, we are. But there's a question of the extent to which that is being driven, or that change is being driven by consumers being more assertive, assisted by their use of new technologies. I think it's swinging very much to the latter, by the way, where the consumers are driving those changes rather than the technologists and the manufacturers and the service providers. The private sector, because of the bureaucracy and the silos and the established ways of working and the cultures in the public sector, the private sector, I think, is best positioned to offer new ways of working. But as I've indicated, there are some dangers lurking around some of the ethical and practical issues. And just as a final comment, the Australian agenda is probably little different to the EU or the UK, but I do think in Australia that you probably have the potential to develop new consumer-oriented services more quickly, so that the rest of the world can shamelessly learn from your experience. And that's partly because you haven't suffered quite to the same extent from the recession and the financial stringencies that we have, certainly in the UK and in other parts of the EU. And of course, you've got pretty good and developing broadband networks throughout the nation, which can be very, very helpful when it comes to communications networks, including video. So some positives there on the Australian front, and we'd like to learn from the lessons from you. And there you go. Thank you very much. Open for questions, I'm sure.
Thank you very much, Malcolm. Great presentation. We're just going to change over slides now, and while we're changing over slides, I will encourage the attendees at today's session to post their questions on the question. And I apologise about this, that you actually were up at about 3 o'clock this morning, and that you are presenting from the south of Wales. So we'll give you a bravery award for those. Thank you for presenting this presentation so early in the morning and from such long distance. But we are very pleased to be having Malcolm come to Australia for the last week of May and the first week of June. And Malcolm's presenting at our conference on the 6th of June at Q Brisbane, and he's one of our keynote speakers at the Community Care Business Transformation and Innovation. Questions coming through the question pane at the minute, and Malcolm, I'll I'll go to the first one. A couple of questions and a couple of comments, I guess. I've asked, what would be the opportunities to be part of the uptake of the International Code of Practice that you mentioned and that Anne mentioned in the introduction?
Right, I think I got that question.
Some comments, I guess. One of the
I'm losing audio actually, but I did get the. Can you hear me, Anne?
Yes, we can hear you perfectly, Malcolm.
Good. Okay. Well, I lost a little bit of the audio there. I understood the question to be about the International Code of Practice for Telehealth Services. Obviously, that wasn't part of my presentation, but it's crucially important because I talked a lot about ethical touchstones, and there's no doubt a very, very strong ethical basis to the international code, which we very much hope will help shape the form of the new range of telehealth services in the future, whether it's using any of the technologies that have been mentioned. So whether people are using mobile devices or installed devices to access services, these are all part of the mix. Now, with regard to the international code, as you pointed to in your introduction, there are a number of services now that are wanting to go forward to become certified against the code, which means actually that they satisfy also the requirements of ISO TS 13131, which is a quality standard for telehealth services from the International Standards Organization. But also the international code covers a wide range of other things, including some of the concerns that I mentioned briefly around user or service user data, personal data, and also issues around how people are safeguarded in the context of the reliability of the technologies, the way that people are involved and informed about the services in question, and so forth. Now, we would love it if certainly services in Australia were to join the telehealth quality group and indeed to seek certification against the requirements of the code. And as indicated, there is a tranche of services that are going to come through this summer and autumn most definitely to become accredited, and which will provide a clear indication that they meet a certain quality benchmark with regard to the telehealth related services that they provide. I'm using, by the way, a fairly broad definition of telehealth, so this does include social alarms and telecare, it does include vital signs monitoring, it does include activity monitoring, it does include medication compliance using automated devices that are linked to central monitoring services, and so forth. So quite a mix there of things that come within telehealth, and I'm doing some work at the moment which is very much focused on video communications for telepsychiatry services, so they also are in the mix. I think that's going to be a big one, by the way, mental health in the next 5 years or so.
Thanks, Malcolm, for that response. I've got some other questions. I'm going to try to combine quite a few questions here that are emerging around the personal data and security of storage. You touched on that in your presentation. Many of the viewers of today's webinar are concerned about the very clear and apparent concern around the level of data security. Yeah. Could you talk about any of the UK European experiences and perhaps some of the more proactive things that are occurring to ensure that high levels of consumer confidence are there?
Yes. Yeah, I'm pleased to. What perhaps participants may or may not know is that there is the European Union is coming out with a general data protection regulation. I mean, there is data protection legislation already in place, but this is a new regulation that will be enforced from May 2018, and there are some fairly rigorous requirements there to try to safeguard users of any kind of service as far as their personal data is concerned. So there's all kinds of restrictions on the way that data can be gathered, stored and shared and so forth. And there are requirements for all kinds of different levels of consent to be in place, informed consent to be in place from those people who buy into or use different services where their personal data is entrusted to that kind of organization. Also linked with that, and I'm not sure the extent to which this will be emphasized within the General Data Protection Regulation, is what I see as an essential need for audit trails, so that if, for instance, you as a service user found that your data was accessed for any reason or shared for any reason which may have been inappropriate, you can track back and find out how it was shared, why it was shared, and who shared it, who accessed it, and so forth. So there would be some kind of comeback in relation to that. And there's a broader issue here, by the way, which I think we all should take cognizance of, and that is about confidentiality. We certainly in the UK all too often find there's instances of people whose personal information has been accessed, or where technologies have been used inappropriately to gather personal information about somebody. And genuinely, nursing staff, care staff, administrative staff, the office cleaner, everybody must be very, very aware of their duty of confidentiality and the all kinds of awful repercussions that might come about if anyone seeks to access or share data that is personal to service users. It may be that some personal data relates to you know, mental health status, HIV, abortions, all sorts of things in the mix that are very, very personal to people, which should not be regularly accessed except in emergency situations. And where those emergencies take place, there must be an audit trail so that it's absolutely clear that that access was justified. One other thing on that, by the way, there is clearly another imperative here around public health. If there are certain if there's certain information about someone's health that might indicate a public health problem, then there may be a duty that would be placed on services to share as appropriate anonymized data about that health information, if it would help to identify, you know, that there's been some kind of increase in some kind of medical illness or circumstances in a particular community, and which might require a public health response. So there are some things that I think we would accept where data could be shared, but where the provisions need to be in place to ensure that people's confidentiality is still pretty well guaranteed, unless it's something pretty nasty that would cause a public health, real public health problems.
Thanks, Malcolm. I've probably only got time for another 2 questions. One of them is from Brad, who's a real champion of digital inclusion in our country. Brad is commenting that he knows from the first ever digital index of Australia that was released late last year, the level of disadvantage, particularly for groups like people with a disability or people who are aged, and in several geographical areas. And I think from memory, Malcolm, in our own state, we've got some of the worst levels of digital disadvantage in some of our rural and remote areas. So he's interested in your comments around digital inclusion and any if you had any suggestions of particularly successful strategies that have come into action in the UK or the European context.
Yeah, well, I suppose there's 2 points to make, possibly 3, I'm not sure. But the first thing is, I think there's an imperative for all of us to try and become more digitally literate, because that clearly opens the wider world and access to services and so forth in an important kind of way. So I think this is an area where public spending is justified, perhaps in those remote or in those disadvantaged areas, or for disadvantaged groups particularly, including maybe very old people, to enable them to develop the skills to get online and to access services and information and so forth. Now, it's all very well. I mean, I'm sitting here in front of a computer with a keyboard, which is pretty complicated, and there were a number of hurdles I had to go through in order to engage in this webinar this morning. There's a challenge for the manufacturers and designers of systems and services to make these things easier. And I'm quite attracted by some of the systems that have emerged, but haven't really caught on yet in the UK for interactive TV, for instance, where there's very, very simple menus, very easy to operate for anybody with limited digital literacy skills, but would give them access to different services and also give them access to all sorts of other exciting things like YouTube, or communicating with their daughter who lives the other side of the world, or whatever it happens to be. So there's positives there around interactive TV. What I haven't seen yet is a translation of that kind of functionality to mobile devices. Now, I will see some good mobile devices, by the way. There's, for instance, the mobile phones, Doro phones, for instance, which are particularly useful and friendly to someone with an older person, perhaps with limited vision and so forth. And so I think the design of the products is improving. iPads, of course, are quite popular, with older people getting used to the idea of scrolling and large icons and things like this. So I think there's some positives there. Perhaps the bigger question for Brad is, or which perhaps is implicit, or he would wish to ask as a follow-up to this, is how do we actually motivate people to engage with those technologies and to take advantage, if you like, of good designs that I hope will emerge more rapidly, and a good range of affordable, accessible services as well. And there, I guess, needs to be just locally based very often, as opposed to centrally dictated, awareness-raising activity in local communities, so that it's then a question of Mr. Brown talking to Mrs. Jones, who talks to the neighbour down the street, and so forth, about what it is that they're doing. Let me think now. 1999. I wrote a report for one of the major charities in the UK, Help the Aged. It was about how people would live, how older people would live in the year 2025. Fortunately, we haven't got there yet, so no one's going to challenge me too much on the content of that. But I foresaw the idea that broadband connections should be available to everybody freely, or as a public service, or as one of the utilities, in the same way as you would electricity or water services. And indeed that there would be basic terminals available public and freely to people, for them to be able to access different services and so forth, but also in order to encourage people to what's the right word here, to develop their well, to become more responsible citizens, so that there'll be access to government services, the ability to vote online, the ability to all sorts of things online that would be available to people in different communities. And maybe we need that kind of approach to take place, and certainly we need local initiatives to ensure that people are more encouraged to become more digitally literate, and therefore able to exercise their responsibility as citizens and access services that may be of help in the context of health and other situations.
Okay. Just one last question, Malcolm. You commented in your slides around the slowness of uptake, particularly in the public sector. This is a comment from one of our expert reference group members who has been involved in a activity that we've undertaken around positioning of the industry for uptake of innovation broadly. And we've been mirroring some of the activities that we've seen in research, particularly coming out of the US, and some of the activities across industries benchmarking an organisation's digital maturity, or a industry-wide view of digital maturity. Are you aware of any similar sort of exercises in the UK or Europe?
Yeah. Well, there's quite a lot going on in the UK and in the EU, actually, with regard to links with industry. because they see the well, a digital Europe as not just providing better services or giving people access to a wider range of services, but they also see it as giving commercial organizations in the EU an advantage in international trade. So there's quite a lot of encouragement and engagement with industry in order to foster that. There is a particular initiative, which is the European Innovation Partnership in Active and Healthy Aging, that has quite a lot of industrial partners involved. And I think the benefit of these kind of fora is that they do manage to raise awareness of the more astute manufacturers and developers about the agendas that they should be addressing, and indeed how they should address them. The tragedy is, with the cutbacks that have taken place to public sector organizations, ironically, you get a lower level of engagement very often in those kind of fora from the publicly funded bodies. Yet they are the ones that are probably closest to the current range of service users, and are actually positioned best to try and change the manner of service provision in local communities. So there's a kind of inevitability that the private sector organizations are going to address the wider private market that exists, partly because they find it very, very difficult to get into the public sector organizations and their tender processes and things like this. And if you're a hard-pressed worker in a local authority or a publicly funded health trust, then it becomes pretty easy for you to actually just carry on the way you are and reissue the tender documents on the same way that you did them in 2012 or something like this. Just for a quiet life, you haven't got time for, you're just battening down the hatches, trying to maintain things as they are, rather than seize the opportunities that actually may start to emerge more in the private sector. There are probably other initiatives apart from the EIP AHA. Oh yes, of course, in the UK you've got Innovate UK, which is very strongly engaged with manufacturers, and in the European Union context again you've got the AAL programme, which was, I forget what AAL stand for, ambient assisted living. They've just changed the meaning of the acronym now, but very much concerned with smart AT and different technologies, and encouraging manufacturers and designers to address what some of the needs that are out there. My worry with that body, by the way, is that there's an awful lot, and I kind of signaled this earlier in my presentation, there's an awful lot of attention to fancy highfalutin technologies, which are not necessarily acceptable to people in their own homes, but they do get some of the technical people quite excited.
Thanks, Malcolm. Thanks for a great presentation today, and that's all the time that we have for questions for today. I'd like to thank you, Malcolm, for your time today, and look forward to your visit to Australia in the coming months. And if anyone wants an opportunity to meet with you, we're finalising your schedule at the moment, so I'd encourage you to contact us. Also, I'd encourage people to register if they haven't already formally for our collaborative. The website is on your screen before you. Encourage you to formally register. That's the way of ensuring that you get all information in respect to upcoming seminars and events. In respect to upcoming seminars, going on the theme, Malcolm, from your presentation, we've got a presentation from the newly convened Open Data Institute on the 23rd of May, and they're going to be talking about open data and the role in community care. On the 26th, we've got some people from Western Australia, from the Independent Living Centre, talking about their MyTech project, which is connecting people to emerging assistive technology. But importantly, I encourage you to register for our conference on the 6th of June. A range of speakers, including Dr Fisk and Dr Karl Kruseniski, as well as a number of other speakers talking about issues very relevant to transforming community care business. We're holding that in conjunction with the Australian Living Lab Symposium, and both events will be held at QUT in Brisbane. By way of concluding today's session, I'd like to particularly thank the Community Care Smart Assistive Technology Collaborative project team, our expert reference group that give their time very voluntary, and I note that Sue, Eleanor and others are on the line today, so thank you for your contribution. We'd like to thank the Queensland Government for their ongoing support of the project and their encouragement for future developments in the project. And last but not least, Dr Malcolm Fisk, I'd like to thank you for your time this morning, particularly acknowledging that it is morning. We're at the end of our day, but you're at the start of your day, and you've had a particularly early start presenting today from South Wales. So thanks everyone for their involvement today, and if you have any queries about today's session or any future activities, please don't hesitate to email us at SAT or Smart Assistive Technology at communityresourcing.com.au. Thank you.